been a long day without you, my friend, and I'll tell you all about it when I see you again. We've come a long way from where we began. Oh, I'll tell you all about it when I see you again. When I see you again.
Damn, who knew? All the planes we flew, good things we've been through, that I'll be standing right here talking to you.
We've kickstarted the 2025 Annual Health Collaborative Convening today here at NOSCAN. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions. We've kickstarted the 2025 Annual Health Collaborative Convening today here at NOSCAN. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions. We've kickstarted the 2025 Annual Health Collaborative Convening today here at NOSCAN. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions. We've kickstarted the 2025 Annual Health Collaborative Convening today here at NOSCAN. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions. We've kickstarted the 2025 Annual Health Collaborative Convening today here at Nosken. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions. We've kickstarted the 2025 Annual Health Collaborative Convening today here at Nosken. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions. We've kickstarted the 2025 Annual Health Collaborative Convening today here at Nosken. We have 10 partners .
Good morning. Can we all please have our seats as we wait for the guest of honor to enter? Good morning. Please let us have our seats now. Yeah, this row. So, as our ushers will continue to guide you to your seats, for our virtual guests, please settle in and grab your coffee. So can we please have our seats? The guest of honor is ready to come in. All right, now that we have our guests of honor in and our VIPs as well, we may start. First of all, good morning. And isn't it beautiful that we are now in Kigali? I really love the excitement. Now I feel like I can't get the room together. So as we hold the excitement, um, it's my pleasure on behalf of the organizing team to give you a very, very warm welcome to Rwanda. For both joining us here in Kigali and the ones that are virtual, thank you for connecting virtually from across Africa and beyond. So now we welcome you to the Official Health Collaborative's third annual convening with the theme From Potential to Impact, Advancing Africa's Health Workforce and Innovation Ecosystems. On that note, welcome to Rwanda. Bienvenue au Rwanda. Murakaza neza mu Rwanda. And just to show that I was in Kumasi, Akwaba. So all protocols observed, we are truly honored to have government officials, leaders, a mix of leaders, innovators, educators, partners, and I'll say honestly, my favorite, the youth. Where are my young people? Wow, I need to get more young people then. So for our guests, the Health Collaborative is a transformative network of 9 higher education institutions across the continent and the University of Toronto, as well as the MasterCard Foundation. So how amazing is this that we all share one common vision of empowering Africa's youth to transform health and through sustainable primary health care. Once again, you're welcome. We are thrilled to have you with us as we officially open this year's convening. So let me teach you one word as you embrace your 1 week of being Rwandaful. Mwaramutse means good morning. So turn to your neighbor and tell them Mwaramutse. Mwaramutse. All right. Again, love the energy. In this spirit of Rwandafulness, please all rise as we observe the protocols and as we sing the national anthem of the beautiful host country, the Republic of Rwanda. Thank you. Please be seated. It's my honor to invite the bold, the amazing Dr. Chengaling, Director of Healthcare Programs at the African Leadership University, to deliver the introductory address and set the tone for today's evening. Please join me in welcoming Dr. Cheng with a round of applause.
Thank you all so much. Murakazaneza. We are so glad to see each and every one of you make your way to Kigali, Rwanda for this annual convening. I'm so grateful to the team that is behind preparing all this. And I'm also grateful for all those who we invited as our external partners, as our VIPs, as our special guests who have managed to grace us with your presence. And of course, special thanks to our young people in the room, our very important stakeholders, and the reason we do all this. So Karen has already given an overview of what we do as a collaborative, but I'd very much want to highlight what we hope to come out of this convening. And that is to really strengthen the bonds that we have as partners of the Health Collaborative, together with our external partners, to improve the lives of young people and to increase their ability to get exposure in the employment world as well as in the business world. I would like to finalize by introducing my chair of the Executive Steering Committee. He is my mentor who has mentored me to be a woman of few words. So I'm going to hand over to Professor Twala.
I'm sure I won't be visible from here. Good morning. I will disappoint you today. I won't have too few words. Good morning once again. Distinguished guests, Dr. Edward Kodzi, the DG of Higher Education Council, Jean Umuhire, Deputy DG, Rwanda Biomedical Center, Dr. Olugbemiga Adelakin, Country Rep for the UN FPA, Development Partners of the Mastercard Foundation, Ashley Collier, Director, Collaborative and Special Programs, Ivan Twali, the Mastercard Director of Special Programs and Collaboratives. I would also like to recognize the Principal of the College of Health Sciences, Moi University, Professor Tege. Welcome. I would also like to recognize all the students and faculty and friends who are here and welcome you to this 3-day event, which we hope will be useful, but most of all, impactful. On behalf of the entire African Leadership University family, it is my great honor and profound pleasure to welcome you all to Kigali in this year's convening of the Africa Health Collaborative. We gather under the theme, which is not just a title, but a powerful call to action, from potential to impact, advancing Africa's health workforce and innovation ecosystems. I'll come back to the significance of this mandate. But first, I want to express our deep gratitude for the privilege of hosting you in this wonderful city called Kigali. There could be no fitting backdrop to our discussions than Kigali, a city that is a living testament to resilience, progress, and visionary leadership. Its journey is the very embodiment of moving from potential to impact. I sincerely hope you will have time to explore its vibrant streets and connect with its warm and welcoming people. This annual convening is more than a reflection, it's our strategic checkpoint. It is a moment for us to as collaborative to recommit to our shared audacious promise to catalyze the training of over 3,000 skilled primary healthcare workers, to upskill 60,000 more to support 5,000 health ventures, to create 20,000 jobs, and ultimately to expand access to quality care for communities across our continent. Our theme this year, therefore, from potential to impact, challenges us to amplify what is working, to scale bold initiatives, and to strengthen the very people and institutions driving progress. Over the next few days, this theme calls us to forge stronger cross-institutional collaborations to tackle health challenges with shared tools and joint purpose. Showcase and champion the models of workforce development that truly align with Africa's evolving health needs. Humble ourselves to learn from community-based and locally led models that are already making a difference, and to see how we can adapt to integrate them. And most critically, to live not just with ideas, but with tangible commitments and partnerships that will advance our collective goals along after the convening ends. I'm really filled with confidence already. Even though this is the official opening, what we witnessed last night in the Founders' Night was extraordinary. The passion, the ingenuity, and the relentless drive demonstrated by our young entrepreneurs in solving Africa's most pressing problems was nothing short of inspiring. We can give them a hand of applause. And if last night was a preview, then I have no doubt that the main feature, our work together over the next few days, will be truly transformative. Once again, a heartfelt welcome to you all, and let us begin the vital work of turning potential into lasting impact. Thank you.
Another warm round of applause for our prof. Thank you so much. And I will say, as a forever student, that was very well put. If I didn't know what this was about, I'll go home knowing what the Health Collaborative is all about. On that note, how do we say good morning in Kinyarwanda? Trying to channel my inner prof. So the second word of today I'm teaching you is to ask, how are you in Kinyarwanda? So when I ask, I will say amakuru, and you say nimeza. It means I'm doing well. Well, if you are. Amakuru? Amakuru? Now, again, in the spirit of being wonderful, let's take a moment to enjoy Rwanda's most beautiful culture, our traditional dance. So please join me in welcoming the Inyamibwa troupe, who will give us a traditional welcome through the power of dance. And don't be shy. If you want to join them, please come forward.
Uraho Rwanda rwacu, uraho Rwanda nziza, uraho rwatubyaye, uraho rwagasabo, urw'amata bateza udatemba, n'urw'amata ameneza avuna imitozo, Rwanda uraho, ibwana mu karini kaminuza, nawe ibwana cyangambwe hari kapitari, Rwanda uraho. Mama ndarawe, uyu munsi ndarari Rwanda, mama ndarewe, uyu Rwanda ni heza cyane, mama ndarewe, uyu ni Nyamibwa nziza, mama ndarewe, mama ndarewe, yumvira ubu sana ko yagiye kuri komine ko yagiye kuri komine kwishakira urwandiko we kwishakira urwandiko rwo kumujyana i Kigali rwo kumujyana i Kigali ye kwishakira amafaranga mama ndare oya mama ndekura ngende nzakubohera kebo nzakubohera kebo utatse amabara yose nyamubatesi wanyoye inganda yabaherana bwirwa n'imbavu ndende we akarangwa n'amaribore mama ndaye wanyoye inka mu batesi wanyoye inka ndayaherana ubwirwa n'imbavu ndende we akarangwa n'amaribore ubwirwa n'imbavu ndende we akarangwa n'amaribore mama ndarewe inyange nyange we wera kwa runyura barimba muheto we Isuguru y'amarembo shengera uragendwa
Usezere, usezere mu Rwanda rw'Abanyarwanda, dukore kw'Imana we,
ruragendwa abahungu ruragendwa abakobwa
usezere, usezere mu Rwanda rw'Abanyarwanda, dukore kw'Imana we,
burya umwana ujya iwabo ntabura iminsi we
usezere mu Rwanda
rw'Abanyarwanda dukore kw'Imana we nimubyine nimutinge ntacyo babatwara
mu Rwanda rw'Abanyarwanda, dukore kw'Imana we,
kuko iyo abaze iminsi ntabagitaje
usezere mu Rwanda rw'Abanyarwanda, dukore kw'Imana we,
ni ukuri kw'Imana we ni ukuri kwa Mungu we ni ukuri kw'Imana we ni ukuri kwa Mungu we
uragendwa.
Wow. Wonderful yet? Yes? And don't worry, this is just an appetizer. Throughout the week, you'll become more Rwandan. By the time on Wednesday is the gala night, you will not just watch them, you will dance with them. Love the energy. So, on this note, please help me to welcome, after this amazing performance, who else can we have after that? Now to share the vision goals, the beautiful part of partnership, and remind us how partnerships and friendships and also working together to improve youth's future is important. Please join me with energy in welcoming Veda Sunasi, the Chief Executive Officer of the African Leadership University. You're welcome.
That's a big mandate you've just given me. I hope I'll cover all of that. It's kind of unfair. You put me right after these performers. Now I feel like I need to sustain this energy. I'm not a man of few words, so I don't know if I can do that with words, but we shall see. I'm also doing a speech for the first time with my glasses. This is new for me, so we'll see. Clearly my eyes' health is not the best, so I'm at the right event, isn't it? The beauty of not being the first one to speak is protocol is taken care of, so I can go straight into it, right? But I'd still like to recognize the government of Rwanda, the Ministry of Health, represented here by our guest of honor, Miss Jeanne Umuhire. We just had a banter earlier about French speakers and being able to pronounce names properly. The Deputy Director General of the Rwanda Biomedical Center, esteemed guests from the Higher Education Council, colleagues from the MasterCard Foundation, those of you who have only seen on Zoom before and I get to see in person, chancellors and deans, also many of whom I've only seen on screen before and I get to see you in person, distinguished guests, partners, friends, and students and colleagues, good morning. Come on, guys, you gotta do better than... On behalf of the African Leadership University, it is truly an honor to welcome you to Kigali and to this convening of the Africa Health Collaborative. I believe we are gathering at a very consequential moment for our continent's health system, when the scale of need and the promise of talent demand that our institutions move beyond aspiration and deliver durable outcomes for patients, for communities, and for economies. At the African Leadership University, our mandate is very clear and quite unwavering. You probably have already experienced it if you've been here for the last couple of days. We develop young, ethical, entrepreneurial leaders, and we achieve financial sustainability through a quality educational experience that endures over time. This mandate is not just a slogan. It is a discipline that shapes our strategy, our partnerships, and our accountability to the students and to the societies that we serve, which is why leadership is very well within our name itself, the African Leadership University. There are three anchors that guide how we fulfill this mandate. The very first one is what we call the 14 grand challenges and great opportunities for the African continent that define the missions that orient student learning and institutional effort. Second is our philosophy of mission, not just majors. That's how we organize curricula and experiential learning around these missions so that our graduates can create real value in the world and in our context today in health systems. And third, we elevate entrepreneurship as both a pathway and a professional posture embraced by founders and by clinicians, scientists, managers, civil servants, and community leaders who bring resourcefulness and disciplined execution to the point of care. This convening sits squarely in that frame. Health is a social good and an economic engine. It creates jobs, it drives innovation, and demands leaders who blend empathy with execution. Universities, like ours, like all of our partners in the collaborative, must be catalysts to train young people for digital fluency, for entrepreneurial problem solving, and for systems thinking. And as the youngest institution in this collaborative, we are, right? I think we are the youngest. We're turning 10 this year. We're celebrating our 10-year anniversary on our sister campus, Mauritius, next week, actually. And as a young university, we are truly privileged to stand alongside fellow members of the collaborative, some giants in research and practice, whose evidence, models, and programs move health systems truly from potential to performance. Together, we can do what no institution can do alone. We certainly couldn't have done what we've done so far had it not been through this collaborative and partnering with all of you. And that is to prepare a workforce that is fit for purpose, that catalyze ventures that solve last-mile problems and strengthen the leadership and policy environments that allow innovation to scale responsibly. If I can go off script for a second here, I'm actually coming to Kigali from Dubai. I am lucky enough to be able to sit on the Global Future Council for Leadership, and I was in Dubai for the annual summit, and there were the future councils for health and climate, etc. And we got to hear from the World Economic Forum the latest research on the future of work. And obviously, we are talking about this in the context of AI and how fast AI is moving. And it was truly heartbreaking to leave Dubai with the reality that us as a continent, we're still playing catch up when it comes to adoption of AI, leveraging AI for research. And I think this is an area where we have to do far better. My team here, Dr. Twala, Dr. Cheng, the Dean, Elizabeth, they'll tell you for the last few months, I've been hammering this idea that We have to do more as a continent, as a place where true knowledge creation is happening. We can't continue playing catch up with the rest of the world if we want to emulate the kinds of transformation that we've seen other nations like China, India, right? Obviously, we are a continent of 54 countries. We can't think the same way as a nation, but it's far too long that we're playing catch up. And I hope through collaboratives like this one and the other collaboratives that the MasterCard Foundation supports, we are able to do much more as knowledge creators and in the advancement of research. And on that note, I truly want to express my deepest gratitude to the MasterCard Foundation and the Rwanda, the Africa Health Collaborative for this sustained partnership, to the government of Rwanda, not just for enabling this collaborative to happen, not just for your innovation in setting up vibrant health innovation ecosystem, for just truly welcoming innovation across the board. We wouldn't have been able to become the institution we are today had it not been for the welcoming country that you are, for such a young institution that we are. And we know that, in this work, universities, we need to become more than just catalysts. Our responsibility is to train that workforce in digital skills, entrepreneurship, systems thinking, connect learning with real problems at the point of care. I also want to explicitly talk about where the future resides. And as Dr. Twala mentioned it earlier, we saw some of that even yesterday. The future, let us be clear, is in the hands of our youth, right? And our responsibility is to provide the scaffolding that will allow them to build what we cannot yet see. The scaffolding for me has at least 3 essential beams. Number 1, top-notch research that grounds decision in evidence, precisely to be able to move us into knowledge creators. The entrepreneurial mindset and skills that translate ideas into solutions, something that we have been adamant needs to be a critical part of higher education since our setup. And lastly, the jet fuel has to be the purpose and passion that propels these young people to innovate and carry us to the next level. So when we assemble that structure with care and rigor, we can create health systems that not only are resilient, but that are relentlessly improving. So colleagues, I don't need to re-emphasize what's already been said, that the stakes are super high, but the opportunity is even higher. With disciplined collaboration, we can build health systems that are equitable, that are efficient, that are future ready. And we can do so in ways that honor the dignity of patients and the commitment of those who serve them. I am grateful for your leadership, for your partnership, and for the seriousness with which you have come to this gathering. To our partners, please engage deeply. Bring your best work. Pressure test ours. The goal is the same: stronger primary care, stronger systems, and stronger communities served by leaders who are ethical, entrepreneurial, and equipped. Once again, to the MasterCard Foundation, to the government of Rwanda, and to every institution represented here today, thank you for making this convening possible. Thank you in advance for the decisions that we will take together over the next couple of days, and for the work that we will choose to do in the hours, in the days, in the weeks, and in the years ahead. Murakoze Chane. Let's get to work.
Thank you so much. Merci beaucoup, Veda. That was really, really good and inspiring. So you overpassed the mandate. So next, we are honored to hear from one of our closest partners, the MasterCard Foundation, whose collaboration has been instrumental in shaping this whole journey. Representing, please welcome Ashley Collier, the Director of Special Program Collaborative for the MasterCard Foundation address. And please welcome Ivan Nwari after his speech for the keynote speech as well. Thank you so much.
Thank you so much. It's really wonderful to be here with you this morning, and such an energizing way to start the morning. Really want to just start by saying a huge thank you to African Leadership University for hosting us here, for really starting us off on an incredible note, to bringing that energy that we will need to sustain these 3 how we catalyze this theme from going from potential to impact. So thank you so much to the entire ALU team for bringing us here today, for hosting us here. I also want to say a warm welcome to the government officials for education and health, the Vice Chancellor of African Leadership University, the members of the ALU Management Board, leaders and representative of all of the universities from our collaboratives, the private sector leaders that are here with us today, and of course, the center of all that we do, the young leaders, the young change makers, the young entrepreneurs that are here to energize us, to lead us, and to show us the way, to show us how we can make the impact that we were looking to make. On behalf of the MasterCard Foundation, I just want to say a huge thank you to each and every one of you for being here with us today, for being partners in this work, and for really catalyzing impact already. We have more to do, but it's really incredible to see how much we have already done together. This year's convening theme is aptly named From Potential to Impact, Advancing Africa's Health Workforce and Innovation Systems. This is really charting the future of what we want to do together and building off of what we've done already. So I want to, for a moment, just take a step back and remind us of how we got here. At our third annual convening, we're building off of so much that has already been done. We began co-creating in 2021 with really the singular goal to contributing to transforming Africa's health systems. We set our focus, our specific focus, on strengthening health workforce training. But we really wanted to challenge ourselves to think beyond training, to think beyond credentialing, and really center ourselves on the journey that a young person takes in transitioning into the health sector. We faced the same paradox in 2021 as we still currently have, which is Africa urgently needs health workers to care for its people, yet we still at the same time have many young people who are unemployed when they graduate. And we want to think about this challenge as an interlocking challenge, thinking about training and the quality of training that young people get, but also to not stop there and to really challenge ourselves to take the journey all the way with young people into dignified and fulfilling work. And that is what brought us together in our shared vision, to prepare and invest in young people with the skills, network, and knowledge that they need to transition into work, but to also transform systems. We all are here to try to transform systems, but we really need to get behind the energy, the ideas, and the innovations that young people are bringing to us. We knew from the beginning that we certainly couldn't do this alone, and I love the saying that even if you could do it alone, you shouldn't do it alone. And that we need from the beginning to bring diverse perspectives, stakeholders together. Of course, higher education institutions are central to this work, but we also need to involve policymakers, governments from all levels, private sector, and youth themselves to be at the center. And the collaborative was designed in this way, to be able to support the delivery of healthcare by enhancing employability of graduates, strengthening that pipeline that carries trained young health workers into the workforce, and then fostering those ventures that are started by young people that are tackling critical changes, but are also creating new jobs for other young people to come into. So as we look to the future and how to amplify and catalyze our impact, as the theme suggests, it's important to also celebrate the incredible impact that we've already made. This morning, the Executive Steering Committee gathered for an hour and a half, and it was really incredible to see the amount of work that has already been done. The foundation that has really been laid the past couple of years for us to catalyze, for us to learn from, and for us to grow. We're seeing some incredible highlights from across the partnerships, but also I just want to highlight a few around cross-institutional collaboration. We're seeing so much work that wasn't even identified in the proposal development and the co-creation. We're seeing the fruits of the labor of us coming together as different partners that have different assets, different skills, and we're starting to come together to put on things like hackathons, to co-create master's degree programs, to do cross-shared faculty and student exchanges, learnings, internships. And these are the things that are going to be critical for our work moving forward. For us to, yes, think about what we can do as our own institutions, but continue to focus on what we can do more together and how we can really break down the barriers and the silos to catalyze the impact that we can have together as higher ed institutions, as different stakeholders within the ecosystem. We have developed over 13 new academic programs and short courses, which is expanding the institutional capacity to deliver health workforce training. And we've engaged over 10,000 young people, including health clinicians, professionals, entrepreneurs, from both short courses all the way to PhD programs. And I think that this is really critical because it showcases that what we are doing is bringing the right opportunity to the right young person at the right time for it to transform their career path. So as I said, there's so much for us to build on. There's so much for us to celebrate already, but to not rest in what we've already done, but for it to inspire us to do even more. What has really brought us, I think, that makes this collaborative truly stand apart is the values that is undertaken, that is the foundation to all that we do. Values like listening, values like co-creation, and values like driving for impact. This influences the way that we work, the decisions that we make, and the way that we enter into partnership. The Africa Health Collaborative, to us at the MasterCard Foundation, I used this word earlier in the ESC, is a blueprint for how we can drive large-scale impact when we work together, when we work collectively. So as we set our sights to the future, and we think about what impact at scale looks like, I just wanted to share two things that we are thinking about at the MasterCard Foundation when we think about scale and when we think about how we drive our work. The first is delivering on our current programs with quality, speed, and agility. The challenge in front of us is vast. The urgency of the issues continue to get more urgent. Young people are asking for us to do more. And we have the assets in front of us in so many ways for us to be able to do more with quality, with speed, and with agility. But this does require us to look at ourselves individually, institutionally, and as a collaborative at where are those barriers that are stopping us from moving at speed, moving with quality and with agility. We really do need to make sure that we deliver on what is promised for young people. And the second is around designing for scale. So designing for scale at the start. Scale, as we likely all know, is not a synonym for growth. It doesn't necessarily just mean to do more of what we currently do, because not all programs that work really well are scalable. But instead, we want to think about how we design for scale with inclusion at the center of what we do. We cannot scale if we are not inclusive. This means building relevant, adaptable, and sustainable solutions that are intentionally designed with inclusion from the beginning. Bringing that diversity of stakeholders, that diversity of thought, to think about how do we crack this challenge. And we know that the people in this room and the systems and the ecosystems that we are all involved in allows us to do just that. So that's the challenge that is in front of us today. And as we continue to connect and learn, be energized, reflect, let's keep making sure that that diversity of thought is at the center of what we do. And that young people's voices are what is driving the conversation, and their views are the ones that are unlocking and delivering this work. So that is the end of my formal comments, and my real job up here actually is to introduce our incredible country director for our Rwanda office, Ivan Ntwali, to share with us his keynote remarks. So I just was priming you, setting the stage for what will be a remarkable speech from Ivan. So thank you so much for welcoming us, and Ivan, please come up.
Good morning. Good morning. That's better. Distinguished guests, health leaders, innovators, educators, policymakers, and our young change makers. It is an honor to welcome you to Kigali for the 3rd Annual Africa Health Collaborative Convening. We gather as a community of purpose, united by a shared ambition to transform Africa's health landscape through collaboration, innovation, and youth leadership This year's convening theme, Africa's health landscape through, I beg your pardon. This year's convening theme, from potential to impact, advancing Africa's health workforce and innovation ecosystem, is more than a title. It is a call to action. It reflects our belief that Africa's greatest strength lies in its people, in their creativity, resilience, and commitment to building stronger, more equitable health systems. When we talk about health today, we are not just talking about saving lives. We are talking about livelihoods, innovation, and opportunity. Africa is home to 18% of the world's population. It carries 24% of the global disease burden, and yet has only 3% of the global health workforce. Yet many trained health professionals remain underutilized, with nearly 70% of Africa's health workforce needs remaining unmet. This crisis also presents a historic opportunity to reimagine health not only as a public service, but as a powerful economic sector that drives higher education, job creation, and innovation across the continent. At the MasterCard Foundation, we see health as both a public good and an engine of prosperity, where young people are at the heart of Africa's health transformation. Our refined health strategy projects that by 2030, Africa could generate 7.6 million healthcare jobs under an aspirational scenario, with 5 million direct roles across traditional and emerging health fields, including digital health and insurance. Because a healthy, digitally capable population is the foundation of sustainable economic growth. This year's convening goal is simple yet so powerful: to ensure every African has access to quality, dignified health care delivered by well-trained, well-supported professionals, empowered by technology, knowledge, and purpose. We are not here to simply discuss the challenges. We are here to celebrate progress, amplify homegrown innovation, and invest in the individuals and institutions driving impact at the community level. This is how we sustain scale this impact. Our partnership with the Africa Health Collaborative aligns with our Young Africa Works strategy, which aims to enable 30 million young Africans, especially women, access dignified and fulfilling work by 2030. Within this strategy, our refined health vision aims to reach 1.3 million young Africans, 80% of them young women, through skilling and enabling 750,000 to transition into meaningful work by 2030. We're not just investing in programs. We are investing in an ecosystem for change. Through our Health Workforce Development Program portfolio, we catalyze youth-centered Africa-led transformation as follows. We have a partnership with the Africa Health Collaborative, which is why we're here today, where AMREF, Addis Ababa University, ALU, AIMS, Ashesi, KNUST, Moi, UCT, and the University of Toronto train and upskill 90,000 health professionals. In Saving Lives and Livelihoods initiative, we're strengthening workforce development and pandemic preparedness with Africa CDC, reinforcing primary healthcare systems. The Madiba project, which acronym is Manufacturing in Africa for Disease Immunization and Building Autonomy, is a collaborative initiative with the Institut Pasteur de Dakar, aimed at strengthening Africa's biomanufacturing capacity and advancing vaccine production on the continent. Africa Stars Fellowship is another one where we're training 131 specialists in biosafety, biosecurity, and bioinformatics to inform public health systems. Community Health Workforce Development Program is one where we will train millions of community health workers, 70% of whom will be young women across more than 20 African countries. The Africa Pandemic Sciences Collaborative, which advances Africa-led research and innovation for pandemic resilience, and CoraLink, a digital jobs for youth in health program that seeks to create 44,000 digital health roles for young people, particularly women. Over the next 3 days, our convening discussions will center around 4 key objectives designed to move us from dialogue to impact. The first will be strengthening cross-institutional collaboration. Here we'll want to break down the silos and build bridges across government, academia, civil society, the private sector, and local communities. Through shared learning, joint programming, and partnership, we can accelerate change at scale. The second, we will be showcasing workforce development models. A strong health system begins with a strong health workforce. We will explore forward-thinking models for developing, attracting, and retaining healthcare talent, ensuring that professionals are equipped for the health challenges and opportunities of the future. Please do watch out for the policy dialogue on primary healthcare session later this morning, which will explore the mismatch in health resources for health between the training of primary health workers and the inability of collaborative member countries to integrate them in their health systems, despite pressing community health needs. Panelists from academia and the foundation will explore the reasons for this mismatch and will explore potential solutions at the policy level that can address this disparity. The session will also consider potential ways to address health system resource constraints and the collaborative's role in bridging the gap between primary healthcare workers training programs, new entrepreneurship models, and sustainable workforce absorption. The third will be elevating community-based models. Communities are not just beneficiaries, they are co-creators of solutions, and we will highlight community-led models that blend local knowledge with scientific innovation and explore how universities, training institutions can integrate these approaches to prepare the next generation of health professionals. And finally, making commitment. We want to make actionable commitments, commitments that will be tracked, monitored beyond Kigali, because progress only counts when it is visible, inclusive, and lasting. Now, let's take some time for reflection. And you're welcome to close your eyes. Imagine a continent where access to quality healthcare is not a privilege, but a fundamental right. Where skilled health workers reach even the most remote communities. Where health professionals are upskilled to deliver world-class care. a world where trained health professionals do not have to migrate to other countries for better pay, and where thriving health ventures create dignified work, strengthen economies, and unlock homegrown solutions. This is not an abstract vision. It is why we join hands with initiatives such as the Africa Health Collaborative, because it is the future we want to collectively build, and it is within our reach if we move together with purpose and urgency. I want to go off script and just tell a small story. About 21 years ago, I was called from a university exam to rush to a hospital. So I was been reflecting about this theme. My mom had come for a convening like this, and she got a headache. And she was taken to the hospital because the headache was persistent. But I was called on the third day. And she had contracted meningitis, but she was being treated for malaria. She never made it. But it made me wonder if perhaps this had been caught early. Maybe she could be here cheering me on. So, as we sit here and we reflect on the importance of this impact and the work that we do and the need to leverage everybody through collaboratives like this one, I think let's reflect on somebody who has no access deep there rural, because we need to level the playing field so that everybody can have the same fighting opportunity to live. So now, at the MasterCard Foundation, we believe that young people are not just the leaders of tomorrow, they are the innovators, disruptors, and change makers of today. Unfortunately, gaps in our health systems threaten the health and productivity of Africa's youth population, reducing the region's ability to reap a demographic dividend. This convening reinforces our commitment to higher education, youth employment, health system strengthening, and inclusive innovations for Africa's transformation. We must invest in young Africans, providing the tools, mentorship, and opportunities to help them shape solutions for their communities. Whether it is a young entrepreneur connecting rural patients with doctors via mobile money platforms, or a young researcher pioneering new diagnostics, their energy and ideas are transforming Africa's health future right now. So what do we want to see out of this convening? We want to accelerate this program's mission through some outcomes. The first, policy and implementation. Transforming innovation into scalable policy to reach millions more people with improved health care services. The second is workforce development. Training thousands of additional community health workers by 2026 through integrated, community-led models. But over the coming days, you'll have the opportunity to engage directly with the continental and global leaders shaping Africa's health agenda. You'll participate in Young Leaders Forums, where Africa's next generation of health innovators will take the stage. You'll visit community and innovation hubs that are redefining local health systems. And please build relationships, the kind of partnerships that last beyond this convening. Before you leave Kigali, I challenge each one of you to make one bold personal commitment to advance our shared goals. Will you be a mentor to a young health innovator? Or perhaps you will champion a new policy initiative? Will you support a community-based health program? Whatever your commitment, please make it count. Let us leave Kigali united with purpose, energized by our partnership, driven by our shared vision. A vision where Africa's potential is not just imagined, but realized in healthier communities, dignified jobs, and a stronger, more inclusive future for all. Together, let's move from potential to impact. And yes, don't forget to experience Rwanda's spirit of hospitality in Kigali, famously known for its 1,000 hills. So my next act will be to invite the one and only Miss Jeanne Omuhire, who's here with us, the Deputy Director of Rwanda Biomedical Center. Please, welcome.
Thank you. I feel like that deserves more claps. It also gives me time to take in the room. Beautiful audience, a beautiful way to start the week. So, distinguished guests, organizers, and participants, it is a great honor for me to be here to this important gathering. I bring my warmest greetings from the Ministry of Health, as well as the Rwanda Biomedical Center and the rest of the government of Rwanda. Let me begin by expressing sincere appreciation to the African Health Collaborative and African Leadership University for hosting this convening focused on innovation and partnership in health. It's a pleasure to be here with you, and thank you for all you do. I also wish to acknowledge the presence of all government representatives, partners, private sector leaders, and students who share a common goal: building stronger and more equitable health systems across Africa. As speakers before me said, this year's event, From Potential to Impact, truly reflects Rwanda's own journey of transforming our country from an ambitious into an action-driven and turning our vision into measuring change. So what I heard today is that we have a great collaboration and partnership that is going to be bringing about or helping us bring about health transformation. And as we heard, it cannot be done alone. It requires collaboration across the government, academia, innovators, and private sector partners. In Rwanda, we pride ourselves to be driven today. I think most of you have heard about the 4x4 reform. That should be a living example how we approach this idea and make it a practicality. Our goal is to quadruple the Rwanda's health workforce by 2028, ensuring that our country meets the WHO target of 4.5 skilled professionals per 1,000 population. This vision and this reform is part of our larger health sector strategic plan 5, and the Ministry of Health has placed the health workforce development at its first strategic pillar. As we heard, without the health practitioners, our health system really would not be able to stand on its own. We recognize that our people, the women and men who serve in our hospitals, our communities, are the backbone of the health system. We're all the backbone of the health system. And we provide the service that we envision. So I believe that today, for me, it's a great pleasure because, I feel like my work for this week is going to be done. At the policy level, when we get up, we think, how are we going to strengthen the system? And I believe that the first answer is strengthening our next generation. As Africa, especially as Rwanda, our greatest resource, and I believe the one resource that is not going downhill, is our young people, our talent, the next generation. We want to continue empowering this next generation by expanding training programs, creating career paths that make it possible to bring about our 4x4 agenda. Again, allow me to commend LAU and its partners for its continued efforts in nurturing youth, innovators, and researchers. The government of Rwanda stands with you and remains committed to creating an enabling environment for startups, health entrepreneurs, and social innovators to thrive. To the students and innovators among us, I think they're at the back of the room, so I'm not really seeing them well, but we're all students at heart, right? I encourage you to align your solutions with our national priorities. One of them being digital empowerment and innovation. As we're expanding our health workforce, we do so by ensuring that we are reinforcing our digital tools, efficiency, and decision-making, and providing better quality of care. By having this digital backbone, we're going to be ensuring that health workers are not only producing, we're not producing more health workers in numbers, but we're encouraging them and empowering them to be data-driven and connected. We want to be capable of using AI tools, like was mentioned here, telemedicine, and other digital platforms to deliver better care to every citizen. In Rwanda, we salute homegrown innovations like Zipline and its drone delivery platform that is supporting our goals to build better digitally connected and inclusive health systems. So again, like my fellow speakers before me, let me go offline. When I saw my colleague and partner from Zipline today, I was like, oh, when I woke up this morning, I thought about you. As we're building better sustainable solutions, we're all very aware of the current global health system with reduced funding from external donors and partners. In Rwanda, we realized that we're going to have to do business not as usual. With efficiency, with partnerships such as what we have through the Africa Health Collaboration of University, we see this as an opportunity. We want to be able to stop saying that, country X and X has reduced its funding to our nation, but rather say that since the reduction in external funding, we have better homegrown solutions. These homegrown solutions are going to be more efficient, more effective. And as my colleague was saying, we're not going to be playing catch-up anymore as a nation. We want to be able to advance to the next level where other nations are not actually thinking about. And I think that the collaboration such as what we have with Zipline is one of those that we're very proud of. We also aspire to become a nation where we are home to biomanufacturing and vaccine production. So I think that that is really what today's convening is reassuring me that we're going to be getting there, thanks to the teachings and thanks to the health workforce capacity that you're going to be bringing to our nation, to Africa in general. I believe that we're one step closer to getting there. So with a resilient and equitable health system, thanks to all the innovation, thanks to the thought partnership that all going to bring about, we must serve a higher purpose. We must strengthen the foundations that we've already built for resilience and equity. Through our vision, Rwanda is modernizing its digital platforms, certainly, but also its health infrastructure at large. We want to ensure that we provide access to essential services and that we reinforce community health insurance schemes to protect families from financial hardship. As we know, a truly resilient system is one where no one is left behind. We've heard it from the keynote address, and we want to make sure that the rural health centers, urban hospitals, and digital platforms that we produce are all connected, functional, and that they're able to respond to the needs of our people. So in closing, allow me to make yet another call for action. Again, congratulations to LAU, to the Africa Health Collaborative and its partners, such as the MasterCard Foundation, for creating this visionary platform for dialogue, innovation, and a partnership. I want us to continue to strengthen our collaborations with our government in Rwanda, but also governments in Africa at large, the academia, innovators, in supporting our youth's brilliant ideas and make them scalable. Again, allow me to reaffirm the government of Rwanda's commitment to building a skilled, empowered, and digitally connected health workforce, one that will not only transform health outcomes in our respective countries, but contribute to better health across our entire continent and the world. Thank you.
Thank you so much, Ms. Chan Mohide, for the amazing remarks. And it's such a pleasure to hear how the country is aligned with what the African Health Collaborative was already planning to work on. And also thank the previous speakers, Mr. Ivan Wadi, as well as Ashley, for your amazing remarks. For people who love data, it was so great to hear all the numbers that were shared today. So for our guests on site, please, we're now coming to the end of the opening ceremony. So please follow the ushers for guidance for your tea break right after. And we'll be back for the public health policy dialogue here inside. For those joining virtually, please take a break, take coffee as well, and we'll be back after in 15 minutes. And that being said, please move as you remember. This is also your chance to connect, talk to someone, collaborate, make connections from this. And we're going to put QR codes, join the community on WhatsApp to easy communication. And please remember to register for your site visits that are happening this afternoon. So thank you once again for joining the HC 2025 convening opening ceremony. Let's keep the energy and see you soon. Thank you.
We've kickstarted the 2025 Annual Health Collaborative Convening today here at NOSCAN. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions.
Yes. And how is it for now? How it yeah, how is it for now? Can you hear? Can you hear with the microphone?
One, two, one, two. Nothing. One, one, two, one, two. Nothing. One, two, one, two. One. One, two, one, two. Yes. One, two, one, two. One, two, one, two. One, two, one. 1 2. Yes. 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 1, 2.
Hello. Joffrey. Now, no, I don't know. No, I don't know your face. You've never put on your camera. Please come back inside. Ah, how are you?
Hi, how are you? Thank you so much for this. Yeah. Okay, great. Excellent. Good. Okay, great. And then will I call up the panel? Okay. Okay, great. Thank you. You want to finish it around 1, right? You want to finish at 1 p.m. Yeah. No problem. There's, and will, do we want the audience to participate? Will there be microphones available to them? Okay, so maybe we'll talk for about 45 minutes to an hour, and we'll go to the audience's questions. How does that sound for half an hour? Yeah. Okay. Dr. John.
I was actually just coming for that. Good to see you too. How's it? Well done with this MC. Just very calm, collective, gorgeous.
Thank you so much.
Dr. John is on. Is there where we can call people back in?
We are calling the volunteers are out there. They are begging people, but
Okay.
I've never seen people.
Of course.
So please, make your way back. Screen. Please come back in. Please come back inside. People are really ignoring us full time. Please come in. Please come back inside. Please come back inside. Please, please. Please come back inside. The panel is about to start. Please, please, please come back inside. I'm going to start calling names. Lillian. Lillian, please come back inside. Please, please come back inside. Please. All right. Ushers, please close the doors and looks like people don't want to go see this beautiful sight. All right, welcome back to the session. I hope you enjoyed your tea break. I know I just stopped you from talking to your people, but at lunch you'll have more time, and as you're also driving to the site. So next we're going to have a panel section that is going to be laid. Let me wait to see if he's in the room. So we will have a panel led by Professor Wong, who will also going to be coming here and welcoming the people on the panel. Do we have him in the room? Sorry. So Professor Joseph Wong was appointed the University of Toronto Vice President International, and he's currently a professor in the Department of Political Science, as well as the Mank School of Global Affairs and Public Policy in the Faculty of Arts and Science. Joe is an author of many academic articles and several books, so please, I'll send you a link after for you to get to know his work. And he has also been a visiting scholar at Harvard, Oxford, and other institutions in the US, Asia, and the UK. And I'm proudly now going to announce also in Rwanda. So please, Professor Joe, come and welcome your panel.
Is that better? That's better. Okay. Thank you very much for the kind introduction. Before I call on the other panelists, however, I just wanted to say a few words to the young people in the audience. And I want to just sort of evoke my privilege as moderator and chair here, but also to really draw on not my administrative role in the university, but rather actually as a professor, and a professor who works very closely with my students and someone who cares very deeply about my students. There's two things I actually want to say to all the young people in this room. The first thing is that I recall probably about 10 years ago, I was working with a group of my own students. There were 5 of them. And we were working on a project on financial inclusion in Brazil. 2 of my students were actually from Brazil. We did this incredible work, did some great data analysis. We then went out into the field and we did this really terrific ethnographic qualitative work in the countryside. We were in the favelas. We also interviewed government officials. This was just extraordinary work, and there were 5 students who were conducting this research with me. It was really their project. And on the day before we were to leave Brazil, I got an email from our Consul General in Sao Paulo who said, "Dear Professor Wong, I understand you're in Sao Paulo, blah, 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 blah. We would like to invite you to the consulate to share your research because we want to bring together policymakers, NGOs, and scholars." And I said to the Consul General, I said, "I'd be very happy to come to the consulate, but it's not my research. It's my students' research. So I'll come, but they'll present the work because it's their work." And I got another email back and said, "Well, dear Professor Wong, we'd really prefer it if you presented the research because you're Professor Wong." And I said, "That's the condition. It's their work, it's their research, they're the experts, they're going to present it, or we're not coming at all." And they, I think, grudgingly agreed in the end. And then I sent an email to the students and said, "Oh, by the way, before we leave tomorrow, you're going to the consulate and you're going to be presenting this research." And they had a momentary freak out. But the next day, we're in the consulate and they presented this work and they hit it out of the park. They just blew everybody away because they knew more about this particular health conditional cash transfer program than anybody in the room. They had all the data, they'd done all the interviews, they had all the ideas, evidence-based policy recommendations, and they had an impact on the evolution of that system. Now, as a teacher, as a professor, what does that tell me? It told me that the constraints that we place on our students are purely our own expectations. If we lift those expectations, or false expectations, there's nothing that should constrain young people. So that's the first thing I just want to say. There's just an extraordinary opportunity that you have now to have the kind of impact that's so profound when you own the work that you're doing. The second thing I would just say is, why universities and why are universities so critical to this kind of mission? Because we underwrite your risk. It's what I say to my students all the time. If there's a time in your life to be entrepreneurial, to be creative, to take risks, to potentially fail, in fact, to inevitably fail, do it when you're in university, because we underwrite your risk. I was just talking to a young entrepreneur who presented yesterday afternoon, whom I met years ago, who came up with his idea while he was a student at ALU. The idea came about when he was a student at ALU. It was informed by a life experience that preceded his time there. The idea came about there. The prototype was made there, such that by the time he graduated, he was able to launch this initiative. The risks that he took were underwritten by the university. So to all the young people out there, this is your time. Because once you're in the real world, those risks have consequences. But when you're in the university, we underwrite your risk. So that's why I just wanted to share. I just wanted to speak to all the young people from the outset, just to say, I watched you yesterday at the Venture Showcase, just the extraordinary courage that you showed, often speaking in your fourth or fifth language, I know for some of you, bearing your ideas, taking a risk that frankly all of us gray-haired in the room would never have taken, right? So congratulations to all of you. Now, the panel that we are going to talk, that we want to focus on now is around policy. I was really, really excited to hear so much talk of policy, a recognition that the policy making process, that the public policies that we have in place shape the systems within which all the actions you're taking can be actualized or can be frustrated. In other words, we need policies that fit the visions and aspirations that we have. And so I can't imagine a better group of people with whom I'm going to be able to have this conversation now than the panel that I'm going to introduce. And I'll just introduce you all in one go. Professor Joachim, who is a professor of public health at AMREF. He's also the Vice Chancellor of AMREF International University, an extraordinary colleague on the Executive Steering Committee, Professor Joachim. Dr. Dawit is the former Chief Executive Director of the College of Health Sciences and Vice President at Addis Ababa University, and a dear, dear friend, Dr. Dawit. Another dear friend, Professor Ellis, Prof. Ellis, who's the former Pro-Vice Chancellor of KNUST and a leading epidemiologist as well. And we should have online Dr. John. Is he there? Do we know? Ah, perfect. Dr. John, welcome. Someone who doesn't need any introduction if you know anything about Africa and health. He is the founder of the Africa CDC. He has had extraordinarily high senior leadership roles around the world in global health. So welcome, Dr. John. It's a real privilege to have you as part of this conversation. So we're going to have a bit of a conversation among us first, and then we're going to open it up to the floor for your comments and your interventions as well. The first thing I want to say is I do hope that we come out of this conversation with 3 or 4 concrete policy ideas, something that we can all leave with, that we can work on together through the collaborative and have the kind of positive impact that we want to have. I've already warned my colleagues that the one policy recommendation we all make is more resources. That's a given. But let's think of other ones, right? And let's think of other creative policy recommendations that can justify ultimately more resources. So the first question I actually have for you is, the panel overview says that we're to explore the mismatch in health human resources between the training of PHC primary health care workers and the inability of Africa Health Collaborative member countries to integrate those workers into their health systems despite pressing community health needs. Now, we've heard this statement several times now. It's a mouthful. What does this actually mean? What is the problem that we're trying to solve here? And if you could describe the problem that we're trying, this mismatch in your own country context, that would be very helpful, just so the audience really gets a sense of what it is we're trying to address through this policy innovation. Why don't we start with you, Dr. Joachim? Joachim, why don't we start with you?
Yeah, thank you. So the problem you're trying to solve, I think, has been talked about again this morning. We have a burden of disease of 24%, if you look at the whole world. So in ideal sense, then we should be having 24% of global health workers in Africa, but we only have 3%. So there is a mismatch there. So the critical need for health workers is there. And it is estimated that by 2030, if we don't do anything, the deficit will be 6.1 million health workers that Africa needs. So the need to accelerate production of health workers is there. And I know year by year, it is estimated that we are continuing to produce about 16% more health workers than before. And so we are on that trajectory. But the disconnect that we are talking about today is that despite this critical need, the health workers we are producing are not getting jobs. So it's an irony. You have a high disease burden, you're lacking health workers, you're trying to produce more, but then they are jobless. That is the problem you're dealing with.
Mm-hmm. Mm-hmm. Dawit, are you seeing the same thing in your work in Ethiopia?
Yes. I think when I'm a psychiatrist, so I live very far away from numbers in my daily life. But so I was going through some numbers, and I was surprised to read that a recent World Bank report projects 500 million youth requiring jobs by 2035 in Africa. And it's a scary number. It's a huge number joining a workforce. And then I was looking at the Ethiopian data, and for the 8 years between 2013 and 2021, the government created 3.6 million jobs. That's against 1.2 million joining the workforce every year, like needing jobs every year. So that's a gap of like 9.6 million in those 8 years. So it's a huge unemployment of youth is a huge problem. When we look at the health sector, with Addis Ababa University, for example, with the employment rate for doctors and nurses of our graduates, that is employability after a year of graduation, either self-employed or wage employed, is roughly around 2/3. So 1/3 of our graduates, of nurses and doctors, fail to land a job within a year of their graduation. And there are a number of reasons for that. We can't say employment or unemployability is a challenge, but I think unemployment is an outcome. It's an outcome of an ecosystem. And it just doesn't happen. It's because of the lack of investment or the investment in probably the wrong things that led to this huge problem of unemployment. That's why I am personally a huge advocate for an ecosystem, an improvement in the general ecosystem. So when you look at the Ethiopian specific situation, why is this specific challenge for health professionals unemployment? It is a sudden change in the way the government positioned itself as the actor. Because it used to be the government used to control both the training and the employment. So we are talking about a government which is 20 years ago, employment was 100% for doctors and nurses because the government was only employer. So in the absence of any replacement to that, in terms of supporting the development of, let's say, a private sector employment capacity, the government decided they're no more going to employ their graduates, our graduates, meaning it has created this gap. And over the years, we've been trying to challenge this reality. Like, we just cannot plan to train thousands of doctors and nurses and then suddenly say, we're not going to employ you. But there are a number of structural and other challenges, which probably I will come back to later. But I see it as an ecosystem challenge.
Great, thank you so much. It's very helpful to hear the numbers and the broader context as well. And I think situating it in the broader conversation around employment, and particularly youth employment, as it was already noted earlier today, there is a demographic dividend that is as yet unrealized. But that demographic dividend is going to be a function of employment more generally. But the irony is in the health sector, where you actually, as Joachim has noted, there's extraordinary need for health workers. There is the supply increasingly through our universities of skilled health workers, yet the absorptive capacity in the health sector remains underdeveloped. Ellis, thoughts from your perspective from West Africa and from Ghana specifically?
Thank you, Joe. And I like to pick it from the historical antecedents and where we've come from, from the primary healthcare concepts, be it in the Alma-Ata Declaration, all the way through to Astana Declaration 2018. And of course, you could also go back and look at the Millennium Development Goals and how we've packaged all of this. It was meant to address key things. One is, are the services and the technical skills and competencies we're producing, are they essential? That's the first one. Are they available? And are they accessible? So the question, so whilst you've described a classical health worker diabetes situation of excess, whilst we have excess and yet we have limited use, we need to address the question, are we really addressing the primary healthcare basic concepts in training, in competencies, and skills? I mean, in Ghana, in the last 4 years, we have close to about 45,000 nurses sitting at home. And just to remind us,
45,000?
45,000. If you look at the health landscape in Africa, 37 to 40% are made up of nurses and midwives, under 10% physicians, and you're looking at biomedical scientists of around 14%. You can disaggregate the rest to perhaps the rest of the percentages, and you really have to ask the question: if you look at the future trajectory of healthcare delivery on the continent and perhaps globally, are we addressing the critical skills, technological needs post-COVID-19? And I guess when we're addressing mismatch, we need to look at these and see whether both present and current needs are factored into what we do. And clearly, the problems as exist in East Africa are the same in West when it comes to the supply versus demand, and whether or not the technical skills and competencies ought not to be looked at from post-COVID-19 into looking at health systems, technological advancements, and the inclusion of the many facets of the opportunities as we have in addressing the potential mismatch. And I guess for me, this is a way to look at the problem beyond the historical antecedents. Thanks, Joe.
Thank you. Dr. John, of course, you, in your role and your leadership role in the Africa CDC, oversaw Africa's response to COVID-19, and Prof. Ellis has just noted how there is this prevailing mismatch in the needs of health systems and the supply of health workers. I'm wondering, Dr. John, if you might provide some of your thoughts in terms of the problem that we're trying to solve right now in terms of public policy. Dr. John, are you there?
Yeah, can you hear me?
Can you hear me? I can faintly hear you, or can we turn up Dr. John's microphone or speaker? Dr. John, you want to speak again?
Yes, I can hear you, Joe.
Much
can you
better.
Hear me?
Much better. There we are. Perfect.
Okay, good, wonderful. I think I really hope the quality of the audio will be good enough to participate in this very exciting conversation. Let me just check again. Can you hear me?
It's perfect. It's absolutely perfect.
Okay, wonderful. So I think the problem we are trying to solve, as others have said, is the huge demographic burst on the continent of young people. We know that of the 1.5 billion people, of the people in Africa today, about 60% of those are young people. That is under the age of 30 or 25, no matter how you count it. So that is huge. As someone said, this huge burst could be a dividend, or it could be a disaster for the continent. So I think that is one. Let's just keep that in mind. To address these needs I'll take a view that it's neither the problem of ability for countries to train. It is, as a colleague from Ghana said, I mean, we have about 45,000 nurses out there not doing anything. So countries are training. So it becomes an issue of, excuse me, of policy and politics, and I'll come back to that shortly. So to address the youth unemployment rates, the MasterCard Foundation is very committed to its program, which we all know about creating dignified jobs, 30 million dignified jobs by the year 2030. So we are a partner in this, and I'll come back to that as well. So to address this issue, I believe, Joe, we need to really step back and say, why are we training excess workforce that we are not consuming ourselves? I think the answer is that everybody needs to do their part. Government, a political commitment must be there. They must develop good policies, and I'm happy we're having a policy discussion. And we need the right partnerships, and we need to understand the population well. So those are the 4 Ps, i.e. the good politics, good policies, know your population, and then the good partnerships. I'll start with the political commitment. Political commitment is so important because the GDPs of the African countries is increasing. In Abuja in 2001, the head of states met and said, look, we need to increase our own funding for health by 15%. In 2025, that is between 2001 and 2025, only 2 or 3 countries have reached that target, the target of 15%, which was an ambitious target, I must say. So that is where we are. At the same time, the GDPs of countries have increased significantly since 2000. Ghana, for example, the GDP in 2000 was around 5 billion US dollars. And today, the GDP of Ghana is above 80 billion. Kenya, next door, GDP was around 13 billion in 2000, and today it's around 130 billion. So the countries have continues to evolve. So it's now a question of the political commitment that drives the good policies, because it's needless having policy without commitment from governments that they will implement those policies, and they have to enable those policies. So there are 3 things that we have to imagine, because we as universities alone cannot solve this. And I said the 4 Ps, we are just a partner in this, right? I think we would like to train competent workforce, but the entire ecosystem needs to be enabled. And we as the MasterCard Foundation are only one of the 4 Ps, which is we are the partners. We are one of the partners, right, in this space. Just as the African Development Bank, the World Bank, they are all trying to solve the problem there. But all of us must do 3 things. One is we must see the invisible in the youths. And Joe, I like where you started, where you, by trusting the youths that they can innovate and they can be entrepreneurs. We must see the invisibles in them, look at them and see what is impossible and see the possibilities in the young people. Second, we must believe in the unimaginable of youths. Again, in 2050, 1 in 4 people in the world will be an African. And if 60% or 70% of those are young people, we must begin to look past 2000. That is just 25 years from now, right? And see what is, and believe in what is unimaginable for our youth people. It just can't be the traditional, I'll do 1,000 jobs here and whatever. It would not solve the problem. We really need to take a projectile view. And then thirdly is to create solutions that are scalable and that are sustainable and simple to implement. They are scalable, they are sustainable, and they are simple to implement. I think that's what we have to do. And I'm not here to prescribe, go into the how of doing that. We are here to raise a policy dialogue. Okay, policy dialogue that speaks to the partnerships, speaks to the role of what the youths can do. The president of Rwanda, President Kagame, just 2 months ago in Senegal at a food insecurity forum, also turned to the youth and said, you just cannot be the youth that are telling us what to do. You have to also be part of the solution. Okay, I think I would like that you Google that speech and look at that. So you're challenging the youth, which says that you have to take that responsibility and say, well, we are part of the solution. We are part of the solution, not just part of the problem, or not just government can solve this. I mean, you need to create, you need to innovate. And I'm seeing that as part of our university collaboratives. When I go to Uganda and other places, I see youth coming out with innovations. I mean, again, it cannot be that we just train these nurses or lab technicians and whatever. We have to enable them with the ability to innovate and facilitate that innovation gets to scale. And that innovation is simple enough that gets to scale, but also create more jobs, right? So I think that's what I mean by seeing the invisible in the youth and believing in what is unimaginable with our young people. So let me stop there.
Thank you very much. That's I mean, that's both. It's inspiring because what you're suggesting is to think about things with a kind of audacity that we might not have thought about with before. But there's also something I'm hearing from all the panelists, and it was really emphasized by Dr. John's comments around entrepreneurship, and that is the importance of the market, right? And I'm a political scientist, and we'll oftentimes think that markets are opposites of governments, but we actually know that well-functioning markets require good public policy, right? Everything from anti-monopolies to property rights, et cetera. These are all functions of public policy. I think it was Ellis who noted that, look, we've kind of historically depended, and others have mentioned, we've kind of historically depended on government to be the sole employer of skilled health workers, whether they be entrepreneurs to physicians, to EPIs and so forth, right? But I'm hearing the market is playing a more important role. Tell me about how you're thinking about the market now and its absorptive capacity of this extraordinary skilled workforce that we have that is intended to meet pressing health needs. Move away from government as the sole employer to markets. Feel free to take a stab, anyone. Joachim.
Yeah, very interesting, because when we are thinking policy, then we must still insist that the duty bearer, when it comes to the issue of health, is the government. So we must still insist that governments must have the right policies in place to absorb as many as possible, and then think beyond that. Let me say something about government. And I think John has talked about the GDPs are growing and all that. And there is a tired discussion around increasing financing, Abuja and all that. It is tired, but we must continue talking about it to increase the market for young people to be employed within government. So we must still do that as part of policy discussions. But another thing in increasing the market for young people to get the employment they need within the health sector is to ask ourselves, what is the money that is spent in health? How much actually goes towards human resources for health, and what is the appropriate amount? I was looking at the different countries. Burundi spends about 11% of its health finance on personnel. South Africa spends 54%. So what is actually the right percentage? I think part of the work that the collaborative can do is to show what that right percentage is through research. How do we optimize the human resources for health? How much should we spend on it? And what do we get out of it? So we can look at what is the appropriate percentage expenditure of the money allocated in health that allows us to create adequate market for absorption while also getting value. And I think that is research. Secondly, the issue of market also deals with how you position that advocacy issue. Is expenditure on human resources an expenditure or an investment? Because many times we say, oh, the government is spending so much on human resources, we don't want to spend more. Are we investing or spending? Again, I think that's something that the collaborative can do in creating these markets for employment in health. Is it an investment? What does it mean when a government spends 54% like South Africa, and when a government spends 11%? What is the outcome in terms of economic development? Are we investing? Is it better that if we spend more, we are creating a healthier population that is more productive, and so there is justification to spend more? I think, again, that's another research issue. But the other thing that captures attention is that 75%, well, it depends, about 60 to 75% of health workers are actually women. Most of them are working for free at the community level as community health workers. So if you believe in inclusion, gender parity, then it's an injustice to have so many women working for free in the health sector. So how do we improve in terms of development for Africa when there are so many people working for free in the health sector? So how we position to increase that market? I'm just saying we need to message around the market within government so that it increases by looking at the impact of increasing that market. But beyond the government, of course, there is private sector which needs to be developed in Africa, in our countries. In Kenya, for example, 50% of health workers are employed in the private sector. And the political will and support for private sector to employ more, I think is very important. And we can do that in other countries so that it's not just government. And then beyond our own countries, our training should be able to equip our learners to work anywhere. So ensuring that curricula are addressing the needs in many countries, ensuring that those curricula are accredited in other countries so that people can go and work elsewhere within the continent. I think all that is still important in increasing the market for employment.
Jump in, anyone feel free to jump in.
Thank you. I think I wonder how much the assumptions we make about our labor market assumption when we propose policies and programs is representative of the actual reality and context of the African population. Of course, I'm speaking from a purely Ethiopian perspective. So it is my observation that over decades, what we are observing is actually a shrinkage of the middle class. So with increasing number of population and shrinking middle class, would the market, with the labor market be really active and robust in terms of absorbing young people into work and so on? I always wonder about our assumption of the level of the labor market is, at least in the specific countries that we work with. In relation to that, I know it's not all about government, but I think, again, looking at realities, the shift I see in most circumstances is not the government shifting from being an employer to a facilitator role. It's actually from being an employer to a barrier. I think that's a major challenge.
What do you mean by barrier?
I'm going to.
Yeah.
It's all about willfully losing certain control over how the economy works, right? When governments politically commit to do this, that's the cost they look at. But in reality, what we see is, in terms of putting in the right policies, in terms of following up on those commitments, and really in terms of expanding the potential for a market economy, they're lagging behind in terms of really delivering on those promises. So they actually become barriers of expanding the labor market. I think that can be discussed further. So I wonder whether there is actually another way of looking at this. Like the majority of the African population are rural population, and in the low socioeconomic class. What we've observed in terms of influencing policy development, when we looked at policies that work and policies that do not work, and what factors determine that development, we actually were able to see in the process of policy making how that policy came about. And to our pleasant surprise, those policies which were derived from, which were actually preceded by services within the health sector, without policy, they were preceded by services, tend to be more successful because the presence of a grassroots policy community, a sort of naturally developed policy community, forces the right policies to actually come up from the government. So in those circumstances, policies work, but when it is purely top-down from government, they tend to fail. So is that another approach? Like, in terms of linking this to what we do, engaging young people, encouraging entrepreneurship and so on, is in a way, the way I see it is that in a way we are encouraging the formation of a policy community that would eventually force governments to commit to such facilitating policies than actually hindering, without intention, hindering such developments.
Interesting. Thank you. Ellis, did you want to?
Yeah, Joe, thank you so very much. I mean, I think my other colleagues have done a fair amount of justice to the market in terms of the government viewpoint. I mean, in Ghana, at least 95% of health workers are employed by government.
Yeah.
And if you were to disaggregate the population, we all agree that is a young population in Africa, the workforce, whereas there's a significant proportion of aging workforce, there's still a significant amount of those who are in the younger age group, which is why we're here. And I also want to refer us all the time to the fulcrum around which the this health collaborative is working, and which is a primary health care, addressing all those issues. So one can look at the market from the viewpoint of obviously government and employability, but also from the skills and competencies of those we're training, and to look at the trajectory of where this is headed. And whereas we're largely rural, I guess there's also the opportunity for different markets that are emerging, which is why those of us in this collaborative have a huge opportunity to rethink the health model. I mean, ideally, one should look at health from 4 different levels of prevention, but it looks as if we're very much concerned about the secondary level, which looks more at curative.
Yeah.
See, but what happens to the primordial? What happens to the primary? What happens to the tertiary? Where we can build the skills of the emerging markets and workforce to look at rehabilitative care. And yesterday, listening to the young voices and founders, it gives me hope. I said and whispered to someone who was seated by me, and I said, I think it was Lisa, I guess. And I was saying to Lisa that, 25, 30 years ago in Africa, who would give you this platform to think about an idea that you can obviously conceive and hatch into the future? So we do have a very huge opportunity to look at the future, rethink this whole model of our curricula. If I were asked one question, I think you have said this to you, if I were asked one question about how institutions of higher learning would look at health going into the future, I would say that there should be a curriculum revolution. We need to look at our curricula and rethink health, from the, away from the traditional model, not completely, obviously have the vertebra in place, but look at the trajectory, and we can see, I like John's, what is it that we can envision? What is it that we can see into 50 years from now? And if you look at the Agenda 2063 and all the facets of it and the many things that we're reimagining, I guess we need to look at the whole health model and look at it from the viewpoint away from curative. In any case, if we were to look at, of course, there's emerging non-communicable disease and all those things, but what proportion do these constitute if we were to look at what the health landscape is as far as Africa is concerned? So the market is there, and there are emerging markets as well, which is where the focus should be for our young founders and entrepreneurs. And that is where we're headed, whether we like it or not. The future is today, and we can see it.
Yeah. John, thank you. Thank you. John, I want to turn it to you as well, but as you're getting back on the screen, Ellis, your point and the points that others have raised, the opportunity to rethink the curriculum, to rethink health systems, to make it more fit for purpose, as it's been noted several times. The majority of Africans live in rural areas. I was just thinking about yesterday's venture showcase and the woman who presented on cataract screening. And if you recall, they're using AI learning models in order to whereby you can upload a photo of your eye, and then I think it was 93% accuracy. It could screen for cataracts. And I remember one of the judges said, well, why would a government be interested in supporting this if it doesn't reach the 96% accuracy? And she repeatedly said, this is not a diagnostic, it's a screen. And in my notes, I actually wrote, why would a government not be responsive to this if it's a screen and it has 93% accuracy, and if that can prevent further degradation in terms of a cataract and therefore prevent needless blindness? Why would a government not? And so I think that really speaks to just rethinking how we actually conceive of health interventions and the role that entrepreneurship can play. Anyway, that was just a side thing. It was one of the irritants that I wrote in my notes, I have to admit, yesterday. And I felt for the venture, the founder, because I thought she had a terrific idea. Whatever it was, 1.5 cents per screen or something like that. I mean, what an amazing, potentially revolutionary intervention that could work. Dr. John, I've spoken too long.
No, wonderful. Just process control. Can you hear me, Joe?
Yes, we can hear you.
Okay, wonderful. I think, let me, great conversation. Let me couch my reflections in addressing the marketplace. You just mentioned, you asked us to reflect on that policy and then the role of collaboratives, right? I think, I believe we should, in this conversation, maybe have a mini policy lab. A mini policy lab that focuses on disruptive innovations. And there are two areas that I would like us to reflect on as a policy lab in this forum. One is, what kind of policies are required, disruptive policies are required, such that the 45,000 nurses that are already trained in Ghana can get into the marketplace. I'm not saying they should be absorbed by government, but they should get into the marketplace. I think, have we thought about the collaboratives working with governments to design policies that will enable these nurses, the 45,000 in Ghana and many others in African countries, to begin to be entrepreneurs in their own right, set up their own shop that are recognized within the policy framework to do certain things. There could be screening of using AI to screen stuff for a fee, send the results to the next tier of a health system or primary healthcare system, etc. Okay, I'm not here to design that, but I want to challenge us that that's one way of disrupting the market, so that the 45,000 are not trained and they probably end up working in a hotel or somewhere at home, just sitting at home, but they create jobs for themselves. And in doing that, one of that setup will create about 5 jobs or four additional jobs. So we could take the 45,000 nurses there through a policy labs and collaborative, working with government, create policies that each of them will can set up their own businesses, employ 5, so you multiply 45 times 5, it gives you a number, that a potential that is out there. There's a paper in the Financial Times that I'll ask that we all read that about 3 months ago, and it says Africa needs jobs, the rest of the world needs workforce. Africa needs jobs, the rest of the world needs workforce. I think that's a good example of that 45,000 nurses out there that are not doing anything, but the world need more than 45,000. The second area of policy lab that I would like us to think of is community health workers, which is the basis of the base of the pyramid. And I think the colleague who spoke first touched on that, about paying or not paying community health workers. I think as a policy lab, we should say nobody in any country should be used or exploited for without pay. I mean, what do we mean by a community healthcare worker would do the job of screening our people, protecting or advancing health promotion or disease prevention for free of charge? And that person needs to go home and feed their family or even maintain themselves. I mean, how do you go from household A to B to C and then get back home in the evening and you have nothing to pay? A policy lab that disrupts that system, that marketplace is indicated. I think we should really have a dialogue on what we could have started there in saying we'd like to mobilize community health workers and use them like the health extension workers in Ethiopia, but it should not be like a standard. that we endorse. I think through a policy lab, we must disrupt that and say, no, if we have community health workers, they must be paid minimally in able to conduct their activities. I think those are the two things that I'd like us to leave this conversation with and say, when we go home, how do we disrupt and work through the collaboratives and design policies and look and see what is invisible with the nurses, okay? Because they continue to be a large segment of the workforce, right? I mean, and it's not the doctors or the specialists there, it's the nurses, community health workers, and midwives. But how do we bring in innovation and entrepreneurship in that segment of the workforce? Especially for the young people, especially for our young people.
Thank you. There's an opportunity here to think about disruptive policies, right? And one of the things that I'm hearing from all of you is how do we, I mean, we have extraordinary health human resources. How do we more optimize the mix and allocation? And Joachim, you were really directly talking about this. How do we more optimize the allocation or the mix, if you will, in the allocation of these health human resources? And here's just perhaps it's a naive question, but it's a legit policy question, which is if there's a surplus of 45,000 nurses in one jurisdiction, and I think Joachim and Dawit, you talked about greater mobility of health workers. This is a continental challenge. It's a continental problem. Again, this could be a naive outsider question to say, why are there not more policies to facilitate more intracontinental mobility in the health labor market to optimize the mix so that specific needs can be met more effectively and efficiently where needs, have to be met in a very local level. So again, perhaps this is a disruptive policy. It seems to be a rational policy, maybe a recommendation that might come out of a policy lab as Dr. John has envisioned, but I'm just curious, is this something that we could work on together in terms of what a Pan-African health labor market might look like?
Yeah, I think that is something we can work on. There are two things. I know we are all talking about doctors, nurses, and in the Eastern Africa region, there is now a common standardization for training of doctors and registration, so that if I train in Kenya, I get certified in Kenya, I can work in Uganda, in Rwanda, South Sudan, and so on. And I think that has gone well because the regulators for doctor training are working together, including standardizing training in universities and so on. But we've not seen that for other cadres like nurses and all the other cadres in healthcare. So one regional policy issue could be how do we accelerate this to recognize training of health workers across borders? Who do we work with? Maybe the East African community, the SADC and the West Africa, WAHU, and so on, West Africa Health Organization, to see how we bring this, we make it better for a health worker to, work in the region. Yeah. And a good example is what we've seen for doctors in East Africa. But that said again,
and that's something universities can be responsible for.
Definitely.
In terms of the training and standardization and so forth, right?
Yeah, we can definitely do that, and we can work, like now the universities in the collaborative, we can ask ourselves, what does training of a nurse in AMREF, how does it differ from in Ethiopia, in South Africa, in Rwanda, and what are the standardization needs that we have? And we can involve regulators in this and see how to make that happen. But that said, I just want to say that we've talked about community health workers. There are so many other cadres of health workers. Kenya did a check on how many cadres are there and working in the labor market. And the regulators came up with 42 cadres, out of which only 17 were officially recognized and regulated And you know, when they recognize and regulate, then they also come up with a job profile, JDs, and all that. So people are able to get jobs as doctors or as nurses or as pharmacists because the profession is known. But out of the 42, only 17 were recognized. So there are a number of other unrecognized professions who are actually the backbone of the health system, including the community health workers, the people who do the morticians. There are so many different cadres that the Kenyan government recognized and came up with. And we need to do this in all countries and ask, what are these cadres? How do we recognize them? How are they regulated? How do we put them in the labor market? Because one reason why we are having a challenge of doctors and nurses not being employed is we are employing these others that are not counted. And we don't know whether we are employing the right numbers. So for each surgeon, as I was telling you yesterday, there are a lot of other people who need to be there for the surgeon to do the surgery. And many times we are not utilizing our surgeons because after one surgery, because these other people are not hired, they are waiting for 6 hours for theater to be ready for them to do the second surgery. So we need to have the theater technician, we need to have the guy who deals with linen, we need infection prevention specialist, all these people. So we should ask ourselves, for each doctor, how many other people should we be employing? For each nurse, how many other people should we be employing? So that we get the right mix. And that talks to the health system issue as well. What is the right mix? Are we overtraining doctors at the expense of the other cadres? Are we paying more doctors than we need? Would we rather have 3 surgeons who are efficiently utilized and a lot of other cadres supporting them than having 10 surgeons who are working 1 hour a day? Those are some of the system issues we need to deal with here.
And these all have to be evidence-based.
Yeah.
Good. Dawit.
Thank you. I just Joachim's comment just reminded me of a data. This is good for a psychiatrist. I'm remembering data. A data about the employment, health science graduates employment in Ethiopia. And the highest number of graduates that are employed above the 90% cutoff is like pharmacists, laboratory technologists, and medical radiologic technologists. Now, if we look at the delivery of healthcare, if we just take these 3, it cannot be delivered. And there is like a huge gap in terms of the employment of nurses and doctors. That's a very interesting challenge, actually. But the opportunity for self-employment in these other disciplines is higher because of where we are developmentally. I think that's probably the case. So I just wanted to follow up on that. But in terms of your question, Joe, again, the way I am looking at that particular question is the mobility within Africa, within the continent, is something we should encourage. And I think we're witnessing a new era in the continent's history where we are seeing a lot of initiatives where we can cite examples of mobility projects when students are moving, faculty are moving, and also people moving from one region to another for employment, with employment purposes. But I don't think that's, again, it alludes to my point earlier. This probably would push for a policy, because that seems to be the way policy works with government. Because what is happening are individuals looking for jobs somewhere and finding jobs somewhere. And instead of that being supported by a transcontinental policy. A good example of transcontinental policy by the African Union is the Trans-Africa Trade Agreement. That's a good one because like in terms of even a good example again with this is, so we pay a lot of money importing medications and equipment, and each country buys its own.
Yeah, it's crazy.
And that's absolutely, and that creates a lot of challenge because the logistic capacity for each nation is quite different.
Yeah.
And also the bargaining powers that would come from like 5, 6, 10 countries coming together and bargaining, and each one going then bargaining is like, so I think that forces the Trans-African Trade Agreement, part of that agreement. I'm not only this, but in general trade-related business. So a transcontinental labor agreement is probably that kind of a policy direction one should look at, because what's happening now, what we're talking about is primary care. So we're talking about community health workers, nurses, and doctors. These are not moving. There is no mobility of this group of health professionals. What we are witnessing now is actually a movement of the highest trained professionals within Africa. I mean, from Ethiopia to somewhere, from Rwanda to somewhere. And what becomes a job opportunity for both the individual and the particular country becomes a loss for another country. And I think governments are quite sensitive and putting a barrier against this kind of integration. But that's one policy direction we may look at as a transcontinental
And this is a way to leverage the collaborative, right? Because it is a transcontinental coalition of universities and generators of high quality health workforce. So it's, yeah. Ellis, I see you're turning your microphone on.
Struggling with my microphone here. Yeah, so my colleagues have addressed the issue of standardized training across some disciplines, which I believe is a way to go. The other is obviously to leverage on existing partnership agreements within the AAU and member institutions, member states. So the AFTA is one, the Africa Free Continental Trade, that's something that we can build human resource, if you like, deployments into, and not just look at goods and services. But clearly we can build that one into a leverage on it. And of course, if there's demand somewhere, why shouldn't that be targeted, to that particular country? And by the way, many of the nurse health workers would go to the global north, in search of the so-called greener pastures, and yet there will still be the demand within the continent and will not be fulfilled. I like to draw our attention to also the need to disaggregate generalized training for what is becoming, if you look into the future, what is becoming very, very interesting. So for example, if you took the projections for the global burden of diseases, cardiovascular obviously will continue, cardiovascular disease will continue is projected. That will be followed closely by mental health. The question is whether or not African institutions, health institutions, are looking at disaggregating generalized training to be responsible for training in mental health and to cater for those areas is something that we have to look at. So again, perhaps that ties into the earlier question on the markets. So it's about time that we moved away from and that speaks very well to Joachim's, for one doctor, what other surrogates you have to complete the surgery. And then also beyond that, the whole area of technology driven. We've been talking about AI in health, and as a collaborative, we've already started a conversation. But what does it mean in terms of a disaggregated health workforce? What does it mean? How do we fashion a policy that looks at leveraging AAU and the various platforms that we have into saying this is how we want the future I mean, we can envision, and therefore this is how we want, training and the skills build up to look like. I've said to my boys, and the future generation of medical practitioners, and I say that in the next 25 years, if we go the way we're going, nobody will be ready to service your carburetor, because there'll be nobody who is expert in carburetor engines. People will be looking at the next generation of vehicles, electric vehicles. And so if you're a mechanic and you're still servicing carburetor engines, you might as well start looking into the future and rethink, what sort of skills gaps do I need? And I think that's where the market disaggregation would have to look at. So which areas, robotics, machine learning, integration of all those things, into what we do. So if you're going to be the medical practitioner, health practitioner, wherever you are, still doing the same old things, you may be out of job. And therefore it's important to look at, how we prepare ourselves and set a stage. When I started biomedical research, 5 years into my work, a colleague scientist says to me, because we're looking for a sequencer at the time, and I'd put a sequencer into my budget, and I was going to buy a sequencer to help us, do what we wanted to do. A colleague scientist from the Northwest said to me, it's going to be one of those things, white elephants that, Africans buy, African biomedical scientists buy. And then after a while, they're not able to service them. And then, of course, it becomes a white elephant. Fast forward, today, we have mini ions. We have all sorts of next generation sequences sitting in laboratories. African scientists have been trained in bioinformatics and all the omics, and are processing all sorts of things. We need to rethink. And I'm not saying this is a majority. It doesn't certainly constitute the bigger proportion, but we need to rethink and start looking at what the future means as far as the platform, but within the continental bodies speak to us going into the future. I think that will help us to position ourselves, for policy that addresses this potential gap.
Interesting. Yeah, thank you. We're going to open it up to the audience in a moment, but Dr. John, I wanted to get your reaction to some of these really provocative observations that our colleagues have made. And while you're sharing your reactions, if there are some in the audience who have some of your own reactions, ideas, thoughts, questions, or whatever, please be ready. And as I understand it, there will be people with microphones to go around. So why don't we get ready for that? And Dr. John, I'd love to get your thoughts on some really provocative ideas that have been forwarded by our colleagues here on stage. Dr. John.
Absolutely, Joe. I think let's go back to some basics. I'm looking for what these collaboratives, what we can do as a collaborative to contribute in that the 4 Ps that I mentioned. We know our population, we know the politics, we know the policies and the partnerships, right? I think there's a document that the WHO and African Union have aligned on, and they call it the African Health Workforce Investment Charter. The African Health Workforce Investment Charter, and it's a framework that guides national policies to reduce workforce shortage by half by the year 2030. Okay, so that document is there. Now, like many policy documents, the translation is always the problem, right? I mean, the translation is the problem. I guess the question now becomes, how can collaboratives such as the ones that we are part of help in translating that into implementation? Get a group of countries and say, hey, look, we have all of these developed by WHO and the African Union, and we get that where it has to be. Let me go back to my nursing example, right? In the early to mid 2000s, we're faced with the problem of scaling up antiretroviral treatment. I just wanted to imagine where we were as a continent at that time fighting HIV/AIDS. And we thought that scaling out ARV treatment could be done only through doctors. Very standard thinking, only the doctors should see the patients and give the drugs. But then we realized that if we have to do that, we would never be able to meet targets. Then we went into a shift, okay, task shifting. Remember that task shifting? thing. And then the nurses were trained to administer ARVs, and that's how we scale up. Okay, we completely scale out treatment. I want to be very practical. That is where a policy intervention, a disruptive policy intervention that when that challenge the standard norms, transform the society. Because the problem we are trying to solve also is not just the youth, but the youth helping them to have dignified jobs and transform societies. That is a good example of what a basic policy transformation completely changed the way that we deliver services and created impact. I think I'd just like us to think about the WHO, the African Union framework. But let me just take my thinking for that. And we have to think of a couple of areas. That one is prioritizing as we think through our collaborative role there. We say when we engage to take this AU document and WHO document, what are the important areas that we should focus on? One is prioritize investment and workforce financing. Workforce financing, such that community-led workers cannot again be voluntary. I think that we should leave this dialogue saying we are all champions of saying a human being cannot wake up in the morning and volunteer their time, and especially young people, and then come back home and then do what? So I think that is one. Second is expand and modernize training systems. I mean, I like the comments from a colleague from Ghana about having people that are fit for purpose for the 21st century. I think that is two. Third is improve retention, protection, and fair pay. Okay, I mean, we are not in, I hate to say this, this is not some sort of socialism where we just think people can work for free, especially those at the lower end of the pyramid. But we need to look at improving retention, protection, and fair pay. Fourthly, we need to look at alignment of governance and data systems. Alignment of governance and data systems is so important, so that we know what we are training, how many do we need, so that we do not end up in the case of say Ghana, where you end, or Cameroon or Nigeria, where you train large number of people that you don't need. Okay, I think that if you have good governance and data system, that will teach us. And lastly, foster innovation and task sharing and shifting, and especially using digital tools. I think that we have to, in our conversation, in our policy lab, begin to look at the role of digitization. Where are we in digitization? Where are we heading to? We are in the fourth industrial revolution, and how is that going to help transform that policy space that we all, for her, okay, especially for the young people. I always use the word redundantly for young people, because that is what our 2030 goals is, to enable 30 million dignified jobs for young people.
Thank you, Dr. John. Very good. I've got some ways in which I'm trying to summarize these excellent interventions, but why don't we turn it now to those in the audience, the participants, who I know and I'm sure have some reactions to some of the things you've heard, and also ideas in terms of how we can continue to move forward this policy discussion. So why don't we have some, I gave you forewarning. Yeah, perfect. We've got a hand back here.
Okay, thank you. Good afternoon. My name is Willie Ngumi. I work at Amref Health Africa. And I just wanted to resonate with what you've been speaking to. I think the keywords I had is about decentralization, the issue of policy, and just to highlight that some of the work we've been doing is around home-based care, trying to open up the space so that trained health professionals and health workers can serve within their communities, regulated, but at least not wait for a job, but actually be able to offer their services at the community level. And I was thinking about a lot of the disruptive businesses that have come up in the recent past have all been driven about making it convenient for the consumer to access, whether you talk about Amazon, Uber, and the rest. It's always about how do you get it closer to the consumer. And as you were talking, I was thinking about the hidden cost of healthcare, the time and effort it takes for a mother to leave her marketplace, to leave her home, and take a child to the hospital for something that perhaps did not really need her to go there, but as a mother, she's concerned. If that kind of a service was available at the home level, then the cost saving would also open up opportunities for them to pay for the service closer to home. So I think a home-based care policy would actually enable many of our markets to absorb health workers who are professionally trained and certified and can actually offer services closer to the home.
Terrific, thank you. Excellent. Got another hand back there, one up here, several on the first row as well.
Yeah, thank you. So I'm Akmal from University of Toronto. I just wanted to share one comment, and that was not discussed, about robotics and AI, how robotics and AI will increase the mismatch. So in 2023, if I can recall the data correctly, 10 million surgeries were done by the robots, and it is increasing. So my colleague was mentioning that the first robot has already come to Kenya and doing robotic surgery, so that mismatch is happening. So it will increase the mismatch. And the question from the panel is medical schools and universities, are they ready to change the way they train nurses, doctors, and midwives? So the current training model is to focus mostly on the secondary prevention, which is early diagnosis and prompt treatment. And they forget about the first one, which is the primary prevention, going to the communities, working with the communities, getting their data, providing vaccination services and health education services in the community, and then working on the other end, which is the tertiary prevention about disability management and rehabilitation. So this is one about are African universities ready to change the way they train their doctors, midwives, and nurses. The second theme is about, as Professor John mentioned, about the P of the politics. So the middle class is shrinking and the wealth inequality is increasing. And based, like some of the figures that I have studied, more than 150 million Africans are pushed below poverty line each year because of the out-of-pocket expenditures. So the policy recommendation, or how can we ask the governments to spend more on the health side so that we can prevent people or households going below the poverty line? Thank you.
Excellent, thank you. Question up here.
Thank you very much, panelists. It was very, very insightful. In the spirit of moving from potential to impact, I'm trying to connect a few dots in my head and sort of wearing the entrepreneurial hat here. I'm trying to sort of connect some dots between the idea that Dr. John put on the table, which is around a policy lab, and I'm trying to connect how that and also the information that he mentioned around how Africa needs jobs. And now I throw in the mix what our colleague just mentioned, the role of AI in all of that. I'm trying to understand, if I'm a private operator, let's say, assume for a second I'm a private operator, and I'm sitting in this room and I'm hearing all of this, and I am interested in job creation. I'd like to hear a bit more, how does a policy lab move us from sort of, all of these challenges to real action, job creation, right? And pretty quickly, right? At a time when, again, the technology around all of this is moving really, really fast. Well, what do we need? How do I get into that space to hopefully understand and influence policy, but also get a sense of how do I, as a private operator, play in that space?
It's a great question, thank you.
Yeah, thank you, panelists. My name is Marie-Claire Ryanyawera. I work for UNFPA Rwanda Country Office. I'm here representing the country representative. Yeah, thank you. The topic is really interesting, from potential to impact, and especially about the Africa Health workforce. I wanted to ask how Africa Health Collaborative can support towards the journey. One of the panelists commented on how the mobility of health workforce can be explored, especially in Africa. And I see it as a solution, and there are possibility for countries to support each other. Recently, we had a learning visit as part of South-South and the Triangular Cooperation in Ghana. And I learned from Ghana that they have a number of midwives, for instance. And while in Rwanda, we are experiencing a shortfall of midwives. So there are really needs to support each other. I wanted to hear more how Africa Health Collaborative can support towards that journey. And my second question is about the potential to young people. I was discussing with some of the colleagues in the room how young people are really showing their potential. Recently, at the Ministry of Health, we supported a hackathon. UNFPA collaborated with the UNFPA through a hackathon journey where we wanted to explore how we can develop a tool that can facilitate the uptake to services in rural area. And that was developed by young people from African Leadership University who haven't yet even finished their studies, and they established a tool that can facilitate. And they are now supporting the National Health Intelligence Center. So I wanted to hear more how we can really enhance the innovation hub, especially strengthening the innovations and the potential for young people. And I'm very sure that there is a role that can be done to strengthen those that creativity and innovation among young people that could be helping us to advance the digitalization, especially in the health sector. Thank you.
Thank you. Why don't we take one more question, and then I'll turn it to the panelists to just react to the group of questions and concerns that have been raised. And Dr. John, I'll start with you just to reverse the order, but why don't we take one more question from the audience first?
All right, hello. Good. Oh, sorry.
Can I say ladies first?
Absolutely.
I can pull that card.
Go
Thank
on.
you. So I really like the idea about the policy, sandbox. But I think historically, at least in Africa, policy moves faster when there's an urgent issue. So like with COVID, we saw, so great mobilization, task shifting, everything that needs to happen for us to, bring it under control. So I think as we're thinking about this issue and how do we find the right policies, we need to ask ourselves, how do we create urgency around a situation? Because external funding does that normally, but in this case, it's we don't want that. So how do we, and what is the role of the collaborative in making that happen? Thank you.
They would sign bilateral agreements. Within a day or two, you'd have so many midwives. We've had that with UK not long ago, where the UK government told Kenya we need nurses. And the government of Kenya said, we have nurses. Of course, they brought another clause and said, test them on English. And some failed English. But those who passed English then just went, and they are working now. So it's about managing the politics, the bilateral agreements, and it can be done. And finally, someone talked about African universities training and including technology and all. I think it can. Okay, so one thing is our health workers who go to developed countries, UK, US, everywhere, they turn out to be among the best. They do a very good job. That gives us confidence that many aspects of our training is okay. But technology evolves very fast, and sometimes we delay in adopting technology in this part of the world. How can we quickly adopt technology as it emerges is to work in collaboration. So collaborative training, University of Toronto working with AMREF, working with other universities, and we do collaborations with other US universities and UK and other countries so that we benefit from emerging technology. I believe they also benefit something from our experiences. That way, then we train globally competent health workers who can also be recognized elsewhere. That is how I would do it. Thank you.
Thank you. Dr. John, you have the final word. You know the saying at conferences, when someone says it's, You're between the whole crowd and their lunch. You're not in the room right now, but you are between the whole crowd and their lunch. But I want to be sure that you have the final word, Dr. John. So please share with us your final reactions to what you've heard today. Thank you.
Thank you, Joe. I think I suspected that you were going to make me give the final word, and I prepared a 45-minute speech. So I'll cut it short to 30 minutes so that I can let you go for lunch. Yeah.
I'm perfectly fine with that.
Really exciting conversations. Really, just a few takeaway messages that we should leave this conversation with a sense of purpose that about what is possible with the health collaboratives, right? So that it's not just an academic conversation. And a colleague said, I mean, I don't know who asked the question about how do we design policies that are in peace times, right? In peacetime and not in urgency, right? When the continent is used to developing health policies where there's an emergency, I mean, HIV/AIDS, COVID, but in peacetime, how do we do that? And I think the answer to that would be that we need to free ourselves from the mindset that it's a mindset shift that says that it's not because we are doing a good thing that government and political leadership will pay attention to that. I think we need to have our own health activists. We have to have activism and championship in the health space that can drive policies. To the extent that the framework that you all know and have heard of, I think it was developed from Ontario and the US CDC about health in all policies. Health in all policies, abbreviated HIAP. I think we need championship for that so that health is embedded across, because as we all know, health is not a standalone, it's the outcome of many failures that have happened in the society, and you need that championship. You need a championship, you need activism. The reason that the HIV/AIDS field has became so powerful is because of activism and because of championship. Who are those champions in the health area that can make sure that when cabinet is taking a decision, they know that health has to be embedded in across the board, because your human capital protection is your greatest assets, right? I think that we have to have people that are saying that consistently, are championing that consistently, so that the centrality of the 4 Ps, that is your population, your policies, your political commitment, not will. There's a lot of political will, but lack of political commitment, and the partnerships. And also recognizing that we, as a collaborative, are only part of that complex equation, okay? And we, as the MasterCard Foundation, we are just one out of a series of other partners, but we need to be in that space, that 4P space, so that we can transform this and create that championship, the activism there. For example, one thing that I'll see us think of is, what is the value of a think tank or think tanks in Africa? Okay, a platform where these kind of conversations can be sustained. It has been extremely exciting over the last 2 hours, but imagine if we have think tanks across the continent that are championing this cause for and sustaining them. Remember, I'm thinking about seeing beyond things that are visible. I'm thinking about believing in things that are not imaginable. And I'm thinking about creating solutions that are simple, scalable, and sustainable. You need those think tanks that will help elevate these kind of conversations. So I'll leave you with that. Just say that it's very exciting, but let's not go home with the concept of the holiness. We are very holy because we are in the space of health, people like us. And why are they not just paying attention to us because we are saving children and humanity? It doesn't work that way. I mean, as government and politics, there are competing priorities on their plate. We should be forcing ourselves into that dialogue, using the health collaborative, using activism, using think tanks to break through into that cycle, so that we have a seat at the table and also have a voice at the table.
Thank you. So thank you, Dr. John. Let me just say in 15 seconds, the Health Collaborative is an extraordinary foundation. The partnerships, as you've seen today, the partnership is very strong. And if we walk away from here with a mandate to think about what a policy lab might look like. And I think we've surfaced 8, 9, 10 different really important, relevant questions that needs an evidence base by which then we can leverage this partnership to do the activism and advocacy that Dr. John has just encouraged us to do. I think we will have walked away from this being able to say this was a very productive discussion. So next on our agenda then is the creation of a policy lab in this health collaborative. Thank you all very much for bringing us here, and enjoy your lunch. Thank you.
We've kickstarted the 2025 Annual Health Collaborative Convening today here at NOSCAN. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions. We've kickstarted the 2025 Annual Health Collaborative Convening today here at NOSCAN. We have 10 partners who are part of the African Health Convening, and we have the young people, our most important stakeholders, presenting their different innovative startups that are improving healthcare of communities across Africa. So what I hope out of this first day of the Founders Night is that you're going to understand some of the challenges that our startups have and how we can best support them across the different partner institutions.
When I see you again, when I see you again. I just woke up from a dream where you and I